Hello students, welcome to the new lecture, and in this lecture we are going to discuss about micturition. So in medical terms, micturition means release of the urine from the urinary bladder, that is known as a micturition. Okay, so in the last lectures we have discussed a pair of the kidneys. They are going to produce the urine. So this urine is brought to the urinary bladder, a pair of whitish structures or tubes that is known as ureters. Okay, so they are going to release the urine into the urinary bladder. So this is about how the urinary bladder is going to store the urine. So urine is stored in this way, which is brought by the ureters. Okay, here in the urinary bladder, just below it, we have the two sphincters. So what is sphincter? The sphincter is nothing but these are walls. Okay, the walls has a closing and opening mechanism. When the walls are open, so what happens when the walls are open? So some substance will flow. Okay, some substance will flow. When it is closed, what happens? It will not flow. It will not allow anything. It means no flow of substance through it. That is the main mechanism of the walls. Here we are saying that two sets of the sphincters, they are muscular in nature and they are looking like a ring. Okay, these are like ring like structure. These are the muscular sphincters. So remember, these sphincters are closed. These sphincters are closed when the urinary bladder is empty. Let us consider the person released the urine outside. So now the urinary bladder is empty. So when the urinary bladder is empty, what happens? Okay, when the urinary bladder is empty, what happens? These two sphincters are closed in condition. Okay, so now these sphincters are closed. Nothing will flow out. Slowly, the urine fills in the urinary bladder, which is brought by a pair of whitish ureters. Okay, so now the urine slowly fills. So when the urine is filled in the urinary bladder up to 300 to 400 ml, what happens? There will be a reflex. Okay, reflex will be generated by the nerves which is present on the walls of the urinary bladder. Okay, so this is going to stretch. Okay, it is going to stretch the wall. So what happens when the walls of the urinary bladder is stretched? So the capacity of the urinary bladder increases. It means it will accommodate, or it can store a little bit more urine. Okay, so 300 to 400 ml is filled, so the walls are stretched due to the reflex. And now at this condition, the first sphincter is going to open. Okay, so while the second sphincter is closed, so the first sphincter is opened when the urinary bladder is filled up to 300 to 400 ml. This is known as involuntary action. So it means this sphincter is opened, the first sphincter is opened involuntarily, but the second sphincter is closed. It is voluntary. It means you can open this sphincter only when you are interested. It means as a result, the urine will not flow out whenever it wish. Okay, so this is the first sphincter is known as internal sphincter. This is known as internal sphincter, and the second sphincter is known as external. Okay, it is known as external sphincter. Okay, so this second sphincter or external sphincter can be controlled by the brain. It means when you are interested, then only this sphincter, the second sphincter, will open. Okay, so in young children, very young children, well, like whether they are about 1 to 2 years or below 2 years, in these children, the two sphincters, the first and second sphincters, not under their control. It means they are involuntary. Both sphincters are involuntary. As a result, they will urinate whenever urinary bladder is filled. Okay, and the person can fill the urine around 300 to 400 ml. When the urine is filled up to 300 to 400 ml, the person can feel that urine is filled up to like some extent in the urinary bladder. Okay, so this urge means wish to urinate will occur at 300 to 400 ml filling of urine. Okay, beyond this, so nerve endings is going to fill, and nerve endings are going to develop a reflex. Okay, so urinary bladder can retain up to 700 to 800 ml. So this is the maximum limit, and beyond this limit, it will be painful. Okay, the person will feel a little bit discomfort, and also a little bit discomfort and a pain, a kind of pain in the urinary bladder. So this such kind of such kind of situation is going to cause voluntary micturition, means the person will urinate. Okay, so this is about it. And 1.6 to 1.8 liters of urine is excreted per day. It means within whole day. So the capacity maximum urine is around 1.6 to 1.8, means you can roughly estimate 2 liters of urine is excreted per day. That is nothing but 24 hours. Okay, so excretion of 2 liters of urine per day is not constant in every people. Okay, some people, those who take more amount of water containing food, they will excrete a little bit more. It means more than 2 ml. The person who drink less amount of water or water containing food, so they excrete less than 1.8. Okay, so this is the urine. Depending upon the food, the urine, the volume of the urine varies. Okay, so next, the questions. These are the these are some questions given in our textbook. That is, do cells need excretion? Yes, the cells need excretion. The cells performs metabolic activities. So as a result, the waste will be generated. To remove waste, the the cells need excretion. Okay, why we advise to take sufficient water? The answer is the metabolism. Okay, metabolism, during the metabolic process, the important functions are going to take place in the body. As a result, the water is necessary to remove the waste materials from the cells. As a result, the water is necessary. The people will advise to take sufficient amount of water, especially your parents and doctors. Okay, why do some children pass urine during the sleep? So the condition is little minimum of 3. Okay, we have taken the 3 examples. So first example is the deep sleep. When the child is in deep sleep, he cannot sense the filled bladder. Okay, he cannot sense that urine is filled in the urinary bladder. So as a result, in the sleep only, the child will urinate. Okay, so next is the some individuals has the hereditary genes. Hereditary means such kind of situation or condition coming from the forefathers, from grandparents to parents, from parents to children, from children to their children, and so on. So in these children, there is a hereditary gene or hereditary disease, so that this disease is going to cause urination in the during the sleep. Okay, so you can consider it as a hereditary gene or a genetic defect. Okay, next is the late development or improper signals, nerve signals to the brain. So when they are in the deep sleep, or when they are in some deep busy condition, or what it may be, so the nerve system is properly not developed. So this improper development of nerve system is going to cause the urine to be released in the night time or during the sleep. Okay, so especially, so the few children, so they do not have the control on urine around 15 to 16 years of age, in only very less people. Okay, so next, we are going to move to the another topic, that is known as composition of the urine. So composition means what? What are the constituents or components that are present in the urine? That is known as composition of the urine. So the composition of the urine varies depending upon the few factors or various factors. So example, urea, the presence of the urea, and presence of the sugars, and next water, and so on. So urine contains all these. Urine contains urea, sugars, water, and so on. So depending upon all these factors, the composition of the urine varies. Okay, it is not constant all the time. Okay, so generally the urine, let us consider this is a urine. In the urine, out of 100 percentage, okay, out of 100 percentage, so 96% will be organic, and 2.5% will be of organic substance, 2.5% of the organic substance in it, and next is 1.5% is of inorganic. Okay, 1.5 is inorganic. Okay, so 2.5 is organic. Next, 9.96 percentage is water, that is H2O. Okay, so see here. So major proportion of the urine contains water. Okay, 96 percentage. 2.5 organic. What we have said, 2.5% organic. Organic means what? Organic means any chemical compound which contains carbon, that is known as organic. So here you can see many things. So like sugar, okay, the sugar or anything sugar, like proteins and all these things are organic. And 1.5 is inorganic, like sodium, chloride, potassium, and so on. So these are nothing but inorganic. So here if you see uric acid and also creatinine and water soluble vitamins, hormones, these all these components contains these carbon compound. Okay, so here inorganic means they do not have carbon. If you take sodium, the sodium do not contains carbon, the chlorine do not contains carbon, phosphate do not contains carbon. These all are nothing but inorganic. Remember all the time, organic means any chemical substance that contains carbon. Okay, inorganic means any chemical substance that do not contains carbon, that is known as inorganic. Okay, urine is acidic at pH 6.0. Okay, so at 6.0 urine is acidic. Let us consider let us consider the urine is brought into the urinary bladder by a pair of whitish ureters. So this urine will have the color like a water. Okay, so how the water look like the same, the urine also looks like at first time. Okay, but here the urine color changes due to a substance, important substance, that is known as urochrome. Urochrome is a pigment that gives color to the urine. So because of the urochrome, the color of the urine is amber. Amber means light brown in color. Okay, so this is the first condition. And second thing is urine is acidic. What is acidic and basic? So let us consider this is 1 to 14 scale. This is a pH scale. Right at 7, the scale of the 7, it is neutral. Okay, so from 1 to 6.9, it is known as acidic. So from 7.1 to 14, this is basic. Okay, it means we say the urine is acidic. What is meant by acidic? You should have the pH below the 7, below 6.9. Here what we said, it is having the 6.0 only. It means the urine is acidic at the first time or at the beginning. And when the person urinates outside, in the outside means in the washroom or in the outside, so what happens? The decomposition will take place. As the decomposition takes place, the 6.0 turns into some kind of basic solution, means it will have above greater than 7.1. okay, greater than 7.1 base, 7.1 pH. It means it is decomposed. Due to the decomposition, the acidic urine turns into basic nature. Okay, so mainly due to the formation of ammonia. Ammonia is a compound that is formed during the decomposition process. So next, okay, wait. So next, there is another condition that is known as end-stage renal disease. What is end-stage renal disease? This is a full form for ESRD. It is short form is ESRD. ESRD means end-stage renal disease. End-stage means last. Renal means kidney. Disease means it is a abnormal function. Okay, so this is known as ESRD. It is a complex and irreversible kidney failure. It means so if once ESRD occurred, that failed kidney will not become normal. That is known as a kidney failure. As usual, the body will not be filtered. It cannot filter the waste material. Okay, and if the body cannot filter the waste material, the waste will be filled. The waste will be filled in the body, and this condition, the filling of waste materials in the body, that is known as uremia. Okay, uremia means waste materials like uric acid and all those waste materials will be filled in the body. Why all these waste materials fill in the body? Because of the ESRD. ESRD means end stage renal disease. Okay, in this condition, the patients will feel tired and weak. They are going to feel tired and weak. Why? Because of the waste materials are filled in their body, along with swelling and swelling of the feet and hands. Okay, swelling is nothing but increase in size. Okay, let us consider this is the hand. Okay, this is the hand, normal hand. So in these people, the hand will be very larger, little bit. Why? Because the water will get accumulate. So water will get accumulate. As a result, the normal hand it will be like this, and the patient, the ESRD patients will be hands will be like this. It means the swelling will be seen due to the accumulation of the water and also waste materials. Why the accumulation will be seen? Because the kidneys are not functioning to remove the water and waste materials from the body. Okay, it is known as uremia. Okay, so there is another question, that is what happens if the both kidneys fail completely. Okay, if the both kidneys are failed, the metabolic waste cannot be removed from the body. As a result, the waste get accumulated, and accumulation of this waste is going to cause a condition that is known as uremia that we have discussed just now. As a result, the hands, legs will swell due to the accumulation of water. The persons will feel tired, and they will feel a little bit suffocation. Okay, and I hope this lecture is helpful to you, and in the next lecture we will discuss the next topic, and this is the notes, and you can copy these notes, and if you think this notes is lengthy, just copy the points that I have underlined. Okay, so or little bit or you can use only the terms that is underlined. Okay, and in the next lecture we are going to discuss about the kidney transplantation. After this topic, the kidney transplantation is the next topic. Okay, we will discuss about it.